Guillain-Barré Syndrome, or GBS, is a rare but serious disorder. It affects the nervous system. Our nervous system controls everything we do, from moving our muscles to feeling sensations. In GBS, the body's immune system mistakenly attacks the nerves. Imagine your nerves are like electrical wires sending signals throughout your body. GBS disrupts these signals. This disruption can lead to various symptoms. The most common symptom of GBS is weakness in the legs and arms. This weakness can spread quickly, sometimes within hours. It often starts in the feet and hands, then moves upwards. People with GBS may also experience tingling or numbness in their limbs. In severe cases, GBS can affect the muscles we use for breathing, speaking, and swallowing. While GBS can be frightening, it's important to remember that most people recover with proper treatment. Early diagnosis and treatment are crucial for the best possible outcome. If you or someone you know experiences sudden weakness or tingling in the limbs, it's essential to seek medical attention immediately. There are different types of Guillain-Barré syndrome, each affecting the nerves in slightly different ways. The most common type is called acute inflammatory demyelinating polyneuropathy, or ADP. In ADP, the immune system damages the protective covering of the nerves called myelin. This damage disrupts the transmission of nerve signals. Another type is acute motor axonal neuropathy, known as AMAN, where the immune system attacks the nerve fibers themselves, called axons. Acute motor and sensory axonal neuropathy, or AMSAN, affects both the myelin and axons, leading to more severe symptoms. The exact cause of GBS is still unknown, but it is often triggered by infections. The most common infection associated with GBS is a bacterial infection called Campylobacter jejuni, often found in undercooked poultry. Other infections like cytomegalovirus, Epstein-Barr virus, and Zika virus have also been linked to GBS. Recently, there have been reports of GBS following COVID-19 infection and vaccination. While the number of cases is relatively low, it highlights the potential for various triggers to activate the immune system and lead to GBS. Researchers are actively investigating the link between COVID-19 and GBS to understand the underlying mechanisms. To understand how GBS affects the body, imagine your nerves as electrical wires sending messages between your brain and the rest of your body. These messages control everything from muscle movement to sensory information. When the immune system attacks the nerves, it's like disrupting the flow of electricity through these wires. This disruption leads to the weakness, tingling, and other symptoms characteristic of GBS. Diagnosing GBS involves a combination of medical history, physical examination, and specific tests. Doctors will ask about recent illnesses, vaccinations, and symptoms. They will also perform a neurological examination to assess muscle strength, reflexes, and sensory function. One of the key diagnostic tests for GBS is a lumbar puncture, also known as a spinal tap. This procedure involves collecting a small amount of cerebrospinal fluid from the lower back. The cerebrospinal fluid surrounds the brain and spinal cord, and analyzing it can reveal abnormalities associated with GBS. Another essential test is a nerve conduction study, which measures how well electrical signals travel through nerves. These tests help confirm the diagnosis and rule out other conditions with similar symptoms. While there is no cure for Guillain-Barré syndrome, treatments can help speed up recovery and reduce the severity of symptoms. Early diagnosis and treatment are crucial for the best possible outcome. Treatment often involves hospitalization to monitor symptoms and provide supportive care. Two main treatments are used for GBS: intravenous immunoglobulin, or IVIG, and plasma exchange, known as PLEX. IVG involves injecting high doses of antibodies from healthy donors into the bloodstream. These antibodies help to calm down the immune system's attack on the nerves. Plasma exchange, on the other hand, involves removing and filtering the blood to remove harmful antibodies. Research into GBS is ongoing, and scientists are working to develop new treatments that are even more effective. Clinical trials are underway to test new medications and therapies that target specific parts of the immune system. These advancements offer hope for improved outcomes and shorter recovery times for people with GBS. Understanding the triggers, mechanisms, and potential treatments for GBS is essential to improve diagnosis, treatment, and ultimately, the lives of those affected by this rare but serious